Healthcare workers continue to serve the public at the risk of their own lives. Since the beginning of COVID-19, many healthcare professionals have been infected, with nurses accounting for most infections. Now, hotel owner Kim Whittaker has launched the Ubuntu Beds digital accommodation platform, which attempts to unite hospitality businesses that stand empty with healthcare workers. A collaboration with Rainmaker Digital through donations and sponsorship, the initiative will be able to accommodate up to 2,500 healthcare workers at no cost. Joining us now via Skype, we are joined by Kim Whittaker, who is the founder of Ubuntu Beds, as well as Thomas Muller, the CEO and founder of Rainmaker. Very good morning to you two. Thanks for joining us. Welcome.
Good morning.
Thank you so much for having me.
All right, Kim, I'm going to start with you. Take us through how Ubuntu Beds came about and what you're hoping to achieve through this initiative.
So, thank you so much. I came back from Germany in March this year, and I was actually corona positive. And the experience of being corona positive and coming back to South Africa and realizing what was going to happen to the hotel industry. And then from then on, speaking to doctors in Italy, in the epicenter of the coronavirus, and them saying, I wish we had spoken to hotels to arrange accommodation for our healthcare workers, because they are exhausted, they're burnt out. And being in the hospitality industry, I thought that's something I could do. I could jump on board and help here. So we launched the Ubuntu Beds platform, and it's been about 100 days now. We've accommodated around 360 healthcare workers already, in accommodations around South Africa. We've got over 1,100 accommodations listed, and all this is possible because platforms of the likes of Rainmaker have jumped on board. They've said, I'm willing to help. Let's match these accommodations with healthcare workers, and let's work on the technology.
So how will this platform connect healthcare workers with accommodation, and how do you select which healthcare workers to go with?
So basically, we've had about 600 healthcare workers apply. We've been able to help 360 so far. Some don't need accommodation right away, but how it works is that they log onto the website, they log their details, they log their HPCSA number or their SA nursing number. We verify that they are in fact a healthcare worker, and then we gauge the urgency. So for example, a nurse in the ICU unit of a COVID hospital would be rated COVID critical 5. So that's how we see how urgent it is, and we really try and help place as many as possible. So we're actively fundraising to pay for these funds.
All right, Thomas, let me also bring you into this conversation. How did the collaboration between Ubuntu Beds and Rainmaker come into fruition?
If you can imagine, if you have to onboard thousands of accommodation providers and match them to hundreds of clinics in COVID-19 centers and test centers so far, that's quite a challenge in terms of logistics and data management. So if you want to achieve that in an efficient way, you need to use technology. You need to have some central reservation mechanisms. You have to have some payment mechanisms in place in order to be able to do that. You can't actually run that in Excel or something like that. So when we've heard from Kim, who I know from other activities, that she's planning to do such an activity, it was immediate to me. I got to support that. I got to assist that, and I got to assist the South African healthcare workers. But on the other side, also the accommodation providers. So this is what we normally do. We have integrated booking applications, a complete ecosystem for the tourism industry, and we're normally aiming to keep more money in the country and have less money leaking out of the country to booking platforms. So that's what we normally do. We work with accommodation providers throughout the entire South Africa. And here we saw the opportunity to really help them who have no revenue at this point in time because of the lockdown, to through Ubuntu Beds have at least some sort of cash flow to stay afloat.
So how will you ensure that these accommodation facilities will adhere to the guidelines set out by the Department of Health, with regards to self-isolation and quarantine?
So I think perhaps I can answer that.
Okay.
We have a health and safety department. And basically we do training, we do weekly health and safety training. We've got guidelines, checklists, etc. Much like any accommodation, we rely on the accommodations to self-regulate. So if there's a big isolation facility in a major center, we work together with the Department of Health to get the local provincial people to come and check that the isolation center is sufficient, that the waste management is all right, etc. Often we rely on apartment owners, etc., in outlying areas to offer isolation where there is no state isolation. And in this case, we give them guidelines, checklists. We actually provide the post-stay cleaning. So we use national providers to do a spray after the guests have checked out and to handle waste management, etc. The day-to-day management of the accommodation, we rely on the accommodation to do this based on our guidelines.
Okay, since it comes at no cost to the healthcare workers, how would you be able to sustain this program?
So we're working with a number of private hospitals, and they are actually paying for their own staff to have accommodation where it's needed. We're actively fundraising, and we're speaking to different provincial departments to see whether they can get sponsorship. We've managed to raise almost 700,000 Rand in private donations and small corporate donations, and this has all gone towards accommodations. Furthermore, our core funding, which is our reservations, etc., has been funded by the First Rand Spire initiative, and so this allows us to put every single rand that we can fundraise into the accommodations.
Okay. Thomas and Kim, thank you so much for joining us. Now, before I let you go, Kim, so how can healthcare workers in need of accommodation get in touch?
So the best thing to do is to go onto our website, which is ubuntubeds.org.
Okay.
And there's a section there for healthcare workers. You can click on it, you can put in all your details, and then we will get in contact and make sure we can help you.
All right. And Thomas, how do we get in touch with you?
You can easily get in touch with us by email if you send an email to getenabled@rainmaker.travel.
Please say that again.
Getenabled@rainmaker.travel.
Okay, great stuff. Thomas and Kim, thank you so much again for your time. Much appreciated.
Thank you very much for having us.
Well, that was Kim Whittaker and Thomas Muller talking to us about Ubuntu Beds, an initiative created to provide accommodation to healthcare workers who are at the forefront of the fight against COVID-19 with accommodation close to their workplaces.